Welcome to Networking and Health Information Exchange, National and International Standards Developing Organizations. This is Lecture C. The component, Networking and Health Information Exchange, addresses what is required to accomplish networking across and among disparate organizations that have heterogeneous systems. As one might imagine, this topic covers a lot of territory fraught with new topics and a lot of acronyms. My apologies, but it is what it is. I suggest you keep your glossary beside you as you study this material. Unit 3 covers National and International Standards Developing Organizations and consists of 3 lectures. Over these 3 lectures, we will continue to discuss the value of health data standards and why there should be global standards. We also introduce you to the national and international organizations developing standards, as well as other significant organizations that influence the creation or use of health data standards. Lecture C is a continuation of the discussion of U.S. standards developing organizations. Although these units are providing much detail of these organizations, you need to know this material if you engage in systems that share data or deal with external systems. Slide 2. The objectives for this unit, National and International Standards Developing Organizations, are to explain why standards related to networking and health information exchange are important, particularly in the current environment. Standards development, which includes how standards are developed, who develops them, how standards are accredited, and how standards are selected. Slide 3. We continue to define the objectives of Unit 3. Understand different kinds of standards being developed and for what purpose. Learn about standards developing organizations and the standards they create. Demonstrate how to find, obtain, and use standards that are needed to facilitate networking and health information exchange. It is likely that you will hear the word standard every day in some setting. In some cases, the speaker will be referring to standards that are produced by a formal process. In other cases, the speaker will be referring to a general concept. Much of the content of this unit will be referring to formal standards. Some standards will deal only with the words we use and the characteristics of those words. Others will deal with actually moving the data from one unit to another. What is required so that the received data is understood by the receiver? Other standards will refer to applications or system components that may be used without creating special interfaces to permit the application to work with other systems. A number of organizations produce standards. Some are U.S.-based, some international, and some both. The organizations mostly create standards for specific purposes. In some cases, standards from different organizations compete for the same functionality. Unit 3 will define some classes or categories of standards that you may encounter in your work. We will discuss how to find, obtain, and use standards from a variety of organizations that are needed to facilitate networking and the sharing of health data with others. A word of warning. This unit includes many acronyms that are part of the everyday language of the people who create and use standards. We will always first give you the words, then the acronym. Once defined, we will use the acronym in future slides. Slide 4. The International Health Terminology Development Organization, IHTSDO, was formed in 2007 as a charter organization with initially 9 country members. That number has now increased to 15. Its purpose is to develop and promote use of SNOMED CT to support the safe, accurate, and effective exchange of health information. Membership in IHTSDO enables countrywide use of SNOMED CT. WHO and IHTSDO recently announced a collaborative arrangement to harmonize WHO classifications and SNOMED CT. SNOMED CT may become a required terminology in the U.S. Slide 5. The Digital Imaging and Communications in Medicine DICOM standard was created by the American College of Radiology, ACR, and the National Electrical Manufacturers Association, NEMA, in 1983. With the release of version 3.0 in 1993, the ACR-NEMA Committee changed its name to DICOM and became international in scope. DICOM is perhaps one of the most stable and widely used standards. It is ubiquitous in all imaging devices. However, there is less stability in the accompanying standards, such as the demographics of the patient and other data relating to the reasons for the image. Slide 6. The DICOM Committee has 27 workgroups addressing different kinds of images in cardiology, dentistry, endoscopy, mammography, ophthalmology, orthopedics, pathology, pediatrics, radiation therapy, surgery, and others. The workgroups have different domain foci and include standards for reporting and security. DICOM addresses multiple levels of the ISO-OSI network model and provides support for the exchange of data. DICOM has also adopted JPEG and MPEG in its suite of standards for images. Slide 7. Almost, if not all, pictures and archiving systems, PACS, use the DICOM standard. The standard includes storage of images and persistence of images, a structure of indexing, labeling, storing, and retrieving images. DICOM also supports other related functions such as printing images on film. With the digitalization of images and the effectiveness of DICOM standards, very few analog images are put on film today. In fact, many places convert film images to digital images and recover the silver from the old films. Slide 8. Integration of the Healthcare Enterprise is a global organization whose purpose is to create a framework for passing data seamlessly from end to end and application to application. IHE is a product of a collaborative effort of the Radiological Society of North America, RSNA, and the Healthcare Information and Management Systems Society, HIMSS. IHE does not create standards, but drives adoption of existing standards developed by other organizations such as HL7 and DICOM to meet specific needs. IHE supports a Connectathon each year at the HIMSS annual meeting. Slide 9. IHE products include integration profiles that describe healthcare use cases and specify what standards, including versions, that should be used to provide seamless connections. These profiles guide vendors in the development of healthcare IT products and may be used by providers of healthcare to define system requirements. Integration statements identify the specific profiles for a specific purpose. Technical frameworks specify integration profiles and identify the actions and transactions. The Connectathon permits vendors to bring their products to prove interoperability working with other vendors. Showcases are similar to the Connectathon, where vendors demonstrate integration. Slide 10. IHE is organized into domains that address profiles and requirements in specific domains of healthcare. The current domains include anatomic pathology, cardiology, dental, endoscopy, eye care, IT infrastructure, laboratory, patient care coordination, patient care device, pharmacy, quality research and public health, radiation oncology, radiology. Slide 11. American Society for Testing and Materials, ASTM E31 Healthcare Informatics, was established in 1970. It now has over 300 members, has 3 technical subcommittees, and over 30 current approved standards. ASTM is a large international standards body that creates standards in many areas. The healthcare focus, E31, is relatively small. With the exception of the continuity of care standards, ASTM standards are not widely used. Slide 12. There is a strong competition between HL7's CDA and ASTM's CCR. In an attempt to diffuse this competition, HL7, working with ASTM, created the CCD, which is essentially taking CCR content and inserting it into a CDA. Unfortunately, that did not solve the competition, and both standards continue to be developed independently. The American Academy of Family Practice is a strong supporter of the CCR, as are many small vendors. The CCR is simpler to implement than the CDA. Slide 13. Other ASTM standards are recognized and used in the field. Perhaps of this group, the Guideline Elements Model, GEM, is most widely used. GEM defines elements and composition for clinical guidelines. The Voluntary Universal Healthcare Identification System is frequently referenced as the only standard of its kind. However, it has not come into widespread use. Slide 14. Accredited Standards Committee, ASC X12, was chartered by ANSI in 1979 to develop Electronic Data Interchange EDI standards. ANSI has the authority to create a standards body for any area in which it believes a standard should exist and for which no SDO exists. The lack of a standards developing organization addressing claims and reimbursement standards resulted in the creation of ASC X12N. The N suffix stands for insurance and is the largest subcommittee of X12. X12N has created a suite of standards noted as EDI standards or business standards for the purpose of claims reporting and processing. These standards are specifically identified in the HIPAA legislation and are required for use with Medicare and Medicaid reimbursement. These standards support eligibility and claims tracking, as well as claims and reporting. X12N and HL7 have worked together to create the Claims Attachment Standard. The current status of that activity is using CDA for claims attachment. Slide 15. These are some of the standards defined by X12N. 835, Healthcare Claim Payment Advice. 837, Healthcare Claim. 274, Healthcare Provider Information. 275, Additional Payer Healthcare Information. 277, Healthcare Claim Acknowledgement. 276, Healthcare Claim Status Report, and Claims Attachment Standards co-developed with HL7. Slide 16. The National Council for Prescription Drug Programs, NCPDP, was founded in 1977. Its membership exceeds 1,500 persons and represents most sectors of the pharmacy services industry. Members are pharmacists, payers, and drug companies. NCPDP standards create and promote data interchange standards for the pharmacy services industry. NCPDP standards have been named in HIPAA legislation in the Medicare Prescription Drug Improvement and Modernization Act, Medicare Part D. Slide 17. These are the important NCPDP key standards that are also named and required for use by HIPAA and also by new legislation to support e-prescribing. SCRIP supports communication between the physician and the pharmacists. Telecommunication, version D.3, addresses data format and content transmission protocol. NCPDP also has defined a data dictionary, names and definition of data elements, used in all NCPDP standards. These standards are being expanded to include the management of refills and for the actual dispensing of drugs by the pharmacy. NCPDP takes a strong step towards interoperability by creating a data dictionary that includes the data elements with attributes used in all NCPDP transactions. NCPDP and HL7 work closely together. Slide 18. NCPDP standards are also used by Pharmacy Benefit Managers, PBMS, for pharmacy claims and reimbursement. These standards relate to the billing and claims process. The other key standards are listed below. Batch Standard Implementation Guide, IG version 1.2, Billing Unit Standard IG version 3.0, Formulary and Benefit IG version 2.1, Prescription File Transfer IG version 2.0, and Universal Claim Form version 1.1. Slide 19. The SDO Charter Organization, SCO, was formed in 2009. Its objectives are: create common information model, define common method for expressing stakeholder commitments, leveraging current terminology and data types work, use common approach to achieve interoperability across healthcare community, and recognizing roles and responsibilities of stakeholders and creating an effective outreach to subject matter experts. SCO provides an environment that facilitates effective coordination and collaboration of U.S. national healthcare standards development. Thus far, little progress has been made in bringing SDOs together, although some of the goals identified above are being discussed. For example, a common reference model would provide easier interoperability among the different standards, as well as addressing the terminology problems. Slide 20. This slide and the next summarize the category of standards, give examples, and name some of the SDOs creating those standards. You will see some examples that you've not seen before. In the generic use category, OCL is Object Constraint Language, which is a language to constrain information models related to such attributes as data characteristics, linkages, or use. OWL is Web Ontology Language, and GIS is Geographic Information System, or Geocoding Standards. These groupings will be discussed throughout this component. Category: Generic Broad Use. Examples: XML, TCP/IP, Web Services, OCL, OWL, CCOW, GIS, SDOs, W3C, IETF, OMG, HL7. Category: Data Definition. Examples: RIM, Data Elements, Data Types, Terminology, Templates, Archetypes, Clinical Statements. SDOs: HL7, CEN, ISO, NCPDP, X12N, IEEE, SNOMED, LOINC, RX Norm, SPL, Open EHR. Category: Data Exchange. Examples: Structured and free-form documents, images, CDA, CCR. SDOs: HL7, DICOM, ASTM, NCPDP, IEEE, X12N, ISO. Category: Knowledge Representation. Examples: Guidelines and Protocols, Arden Syntax, Glyph, GEM, Prodigy, Protege, VMR, Jello, Disease Management. SDOs: HL7, ASTM, CEN, Open EHR, ISO. Slide 21. This slide continues to define the categories of standards. In the applications, clinical standards that need technology syntax are beginning to appear in the SDOs we have discussed. Category: Electronic Health Record. Examples: Functional Requirements, Content Datasets, Minimum Datasets, EHR Models, Architecture. SDOs: HL7, ASTM, CEN, Open EHR, ISO. Category: Security and Privacy. Examples: Encoding, Encryption, Authentication, Authorization, Integrity, Digital Signature. SDOs: IETF, OMG, ASTM, HL7, ISO. Category: Application. Examples: Identifiers, Resource Registries, Toolsets, Conformance Requirements, Certification, SOA, Simulation, Implementation Manuals. SDOs: HL7, ASTM, ISO, CEN. Slide 22. This very busy graphic also presents a summary of what we have learned in this unit. The cubes represent the categories of standards required for interoperability. The green boxes represent the standards that exist to support the category of standards. The standards contributing to what is required are identified in the upper left of the slide. Storyboards and use cases are part of the planning process. MDF is Methodology Development Framework, and DAM is Domain Analysis Model, an important standard process for planning. Although you may not use these standards formally, you should plan before embarking on any system. We have not mentioned identifiers: person, provider, facility, employer, or health plan, but these identifiers are critical for interoperability. And obviously, privacy and confidentiality must be addressed across all of the components and standards. Slide 23. The two URLs. Standards Knowledge Management Tool, JIC ISO project sponsored by Université de Sherbrooke. www.skmtglossary.org. Most major standards listed. Duke Center for Best Practices. www.ctnbestpractices.org/standards-inventory will provide access to many of the standards we discussed. Navigation might be challenging, but it is worth a look. Slide 24. HIT data standards will continue to evolve, and new standards will be introduced. Most standards are created by a consensus process by individuals interested in influencing, developing, and using the resulting standards. To participate, join the SDO and participate in the work groups. Most SDOs provide tutorials and educational opportunities to learn about the standards. We hope you have developed an appreciation for standards and their importance to HIT and the current models for healthcare. Slide 25. This concludes National and International Standards Developing Organizations. This unit has provided an introduction to health data standards, how standards are made and by whom, types and categories of standards, and has discussed briefly the process, domains, and authorization of standards.